I'm Dr. Thompson, the editor of Health and Development Magazine, and we are at the Gonzales B Conference Center, downtown San Antonio. And with me is...
This is QUINTA LUM. I'm a physician assistant, originally from the state of Maryland.
And how many days have you been part of this meeting?
I came in on Saturday night, so I actually started the conference on Sunday proper in my classes.
You have been part of a number of the presentations and lectures. What part has interested you a lot based on your type of practice?
I would say based on my practice, which is urgent care / pediatrics, I've learned some new things, but the biggest that I took out was from the exposés, networking, and meeting other people in my field of practice.
The AAPA has just brought out a publication stating, trying to clarify certain myths. One of those is that AAPA members cannot actually see patients independently without the supervision or the presence of a physician. What do you think about that?
I would say there's a big clarification about that. It doesn't actually state properly that the presence of a physician. There's a distance-wise, within a certain vicinity, the physician or the doctor should be reachable. So I would say, in a way, we really do practice independently, but you just have to be able to reach the doctor in terms of questions or concerns or time. So we're basically practicing independently, but our scope of practice just states that a doctor should be reachable, time.
You originate from Cameroon. What is the commonality and differences between what operates here and what operates in Cameroon? And apparently there is no assistant physician organized setup in Cameroon. So what is your take and what's your advice as to getting input from physician assistants in the third world like Cameroon?
Well, that's very true. I don't think in the Ministry of Health in Cameroon there was anything ever enacted as the scope of practice as a physician assistant, as opposed to like South Africa, where it was enacted in government way before the program even started. So I think that's what we call development. We also talk about networking. So these are things that we can share, with our country, that even though we have like nursing, which that profession has been around forever, they have a strong union, the nurses everywhere, we can also introduce that we can alleviate some of the work from our doctors in Africa by introducing the physician assistant program, which would also really help, in bringing employment, because if you think about Cameroon as a whole, getting into queues is not a easy thing. So if you have another program, such as a PA program, where people who don't really pass the entrance exams into queues can practice for a shorter period of time, or learn for a shorter period of time and still practice medicine in Cameroon, it would really help some of our health concerns and the shortages that we're seeing now.
How are physician assistants different from nurse practitioners?
The big difference between physician assistants and nurse practitioners is just where they can basically practice on their own. They don't need a supervising physician to be on board or within a certain distance or reachable for them to practice. So they can have a stand-alone practice. You can have a practice and say, oh, this is my family care practice, but physician assistants, we still have to have that doctor that we're delegated to. We have to have somebody, that signs to have a practice with us. So that's something that we're trying to work into the legislature. And it's going to take time because, just like I said, the nurse practitioners have been there forever. They have a stronger union that stands out for them. And we're still working our way into